Hi, Paul. Why don't you tell everyone about who you are and what you do?
Hi, Adam, and thank you so much for having me on today's podcast. My name is Paul Robinson. I'm Director of Strategic Partnerships for Doctify, and Doctify is a real-time digital feedback system for health and social care. And we basically enable providers to collect higher volumes of reviews on a consistent basis. And a byproduct of that is greater insights to the care that you provide, improved online reputation, and also improves the quality of care as well. And then from a consumer point of view, reviews help to build trust, eliminate doubt, and obviously are incredibly influential in their decision-making process.
Yeah, 100%. 100%. Great. Well, thank you. Well, you've touched on it there, but let's get straight in. Why are reviews and testimonials so important?
Okay, so the review industry has been around for ages. It's something like 88% of consumers use online reviews for choice. So that's no different to healthcare. So the way you search for a hospital, a hotel, restaurant, you activate for the reviews. We're just bringing that into social care. So reviews are incredibly important. They're a big part of the decision-making process. But ultimately, from a provider point of view, you can gain incredible insights into the service that you provide just by simply asking the question and getting feedback. So reviews are incredibly important.
These reviews and testimonials you mentioned, Paul, 100%. They are so vital in that decision-making process for families. Now, let's remember, a prospective family member, if they see a positive review or testimonial from another family member, that can make or break them, even making that first inquiry with a care home. There's so many different things that can propel someone to just initially make that first inquiry. And if they have seen or read or heard about these great reviews, then that can be a kind of watershed moment in that decision-making process. In terms of where family members can see those reviews, let's talk about where the platforms where people can learn and read and see those testimonials and reviews.
Yeah, so this is really simple. It's just understanding the consumer journey to how they get to you. So a big part of that maybe starts with word of mouth. So once somebody's got the name of your care home, what do? And I'm sorry, the yellow pages have gone. Once they've got the name of your care home, they're going to Google you. So that first page of Google is your shop front window. So it's incredibly important to look good on the first page of Google. So that's with Google reviews. You can use third-party websites as well, because that's the snapshot. And what you were saying earlier, yes, it's important for them to actually read the testimonials, but more on a granular level, it's a snapshot. They want to see volume of reviews and they want to see a rating. And in a lot of cases, that's enough just to phone the number. But what you don't want to do is that when they Google your care home, they see low volumes of reviews, or the last review was 6 months ago. That really doesn't build trust on that first page of Google. So it's just really important at that first page of Google just to maximize the results by having good volumes of reviews, yesterday's reviews, and in a way that consumers can dissect and get more information from. And then a follow-on from that is that when they come onto your website, it's incredibly important straight away to build trust. And the best way to do that is to showcase reviews. You have to go onto any website now and you see trust boxes on there. Why? Because consumers want to see them. It's incredibly important for.
I think we're hitting nail on the head here in terms of Google reviews, because what I think they are generally underused by care operators. And I wonder, so I think immediate message right now is get those Google reviews up and running, because as Paul mentioned, the power of Google in that decision-making process for a family. What about getting those reviews and encouraging families to put up those reviews, for example, on Google? I know that they may have their processes, well, they should, for carehome.co.uk for getting the reviews up there. But what about for Google? Do you have anything to say about encouraging operators to encourage their family members to get those reviews up?
Yeah, look, I think that there's actually a bigger problem within social care and the Google review thing. I mean, we looked at 400 care homes in the UK, and the average number of Google reviews collected for those care homes was only 4 reviews. So 4 reviews is crazy. So why is that? Well, maybe the care homes are not asking. Maybe the families are saying that they're doing, but they don't. Maybe they don't want to put their name to Google reviews for fear of reprisals, or maybe they just don't want to sign up with an email address. But I think that Google reviews are important. Important is to collect enough Google reviews to build trust. And this isn't just something that you do, 1 month of the year. It's something that you aim to do consistently. Because, if I was looking for a care home for my mum, I'd want to be able to read yesterday's review, not reviews from 6 months ago. But I think that within their health and social care space, there is a problem fundamentally with the way Google reviews works for a lot of healthcare providers, because in our healthcare space, we have an anonymous feedback system. We find we collect more reviews because people want to be more open and honest about the feedback that they give. So yes, Google reviews are important, but it's just about an even spread and collecting reviews to build trust.
Yeah, sure.
But there's ways you can collect Google reviews. I mean, we work with hundreds of practice management systems that send out review links. Our system itself enables you to leave Google reviews. But yeah, it's something that must be done. But no one's kind of really solved that problem. Reviews.
And in terms of, you've also got on your website, on the care operator's website, is vital. Yeah, again, it's a classic time operators are better than others. My advice is make sure you've got a positive testimonial review sprinkled on every single page of your care operator's website. So it's always there. You can perhaps even be a pop-up. But then you're looking at the importance of video testimonials as well, increasingly. So there's actually very little excuse and reason for a care operator not to get in some way a video testimonial. We've got the power of Zoom, for example. And then, of course, you've got the more slicker operations, video operators who can get you that great video testimonial. But have you got any thoughts on the power of video testimonials?
Yeah, I mean, look, I think video testimonials would be great. I just think the setup to obtaining those and the workload to getting them uploaded onto websites, that's probably a bit of a barrier of entry. But I do believe that video reviews is part of the future. I think it would be great to collect consumer stories about the service that they're receiving. And videos are a nice way to do that. The problem with that, you can't do that on volume. So yeah, they're great to do, great to have on your website. But yeah, is it sustainable all the time? I'd probably question that a little bit.
Yeah. And then we talk about, other, bear in mind it's family members we're really talking about here. And then you have other places that those reviews will be seen. So you have, I'm thinking of here, we've got Facebook and also, of course, Google, carehome.co.uk. And again, I think some operators are better than others getting that system for getting reviews from their families up onto carehome.co.uk, because that, the carehome.co.uk algorithm, one of the factors is involved is the percentage, the number from 0 to 10 on those reviews, and also the number of reviews. So as I understand it, the carehome.co.uk algorithm is probably changing the whole time, as it does for most of these tech platforms. But start to increase your organic rating. We can talk about the page ranking in a moment. But those good reviews from family members are really, really key. So, the carehome.co.uk is the biggest player for those listening here. So it is absolutely vital that you have a system and a process I think, to make sure those reviews and testimonials are on carehome.co.uk. What are your thoughts here, Paul?
Yeah, just I mean on that. So yeah, look, I mean what they've done is brilliant. They've kind of paved the way for many years. You know, fundamentally, I think I being higher up on the list and paying more money to be higher up on the list kind of goes against everything we're about. It's more we want to promote the best care home for the service that they provide, but I kind of want to go like right back to the beginning. Like fundamentally, there is a problem within social care in regards to the volume and the consistency of reviews that are collected.
Yeah.
So back to the Google example, 4 Google reviews is not enough to give choice. We looked at those same care homes on another review site that you mentioned, and the average reviews was 40 reviews. 44 reviews to make a choice of something as big as placing your mum into a care home is crazy. And bear in mind, those 44 reviews are spread out over 7 years. It's funny, I spoke to a care home operator the other day, and they are targeted to collect 2 reviews a month. Let that sink in. 2 reviews a month. That is crazy. That enough reviews to really understand the service that you're providing. It's not enough reviews for you to sing and shout about online. And ultimately, it's not enough reviews for the consumer that is looking for care. So I just believe that there is a better way to collect feedback within social care. I believe that care home providers should collect higher volumes of reviews consistently, depending obviously the number of beds they have. But if you make something easy enough to leave feedback, then people will do it. It's something like 70% of people will leave feedback if they're asked. Well, if that's the case, why is there so low volumes of feedback within social care?
What would you advise on the process for collating and collecting reviews and testimonials?
Yeah, so look, there are multiple ways now to collect feedback. Third party systems like ourselves, but there are different ways to collect feedback. And I think what people need to look at is, are they happy about opening up their services and being completely open and transparent about the service that they provide? If they are willing to be open and honest about the service that they provide, then start collecting feedback and giving people the opportunity to leave feedback. You do find that the more open and honest you are about the service you provide, the quality of service goes up, the quality of care that goes up, and ultimately it helps consumers in making a choice. So look, I mean, obviously we have a system in place that enables care providers to collect higher volumes of reviews consistently.
And how does that work?
It's really simple, and we haven't reinvented the wheel, Adam. It's just super slick, super sexy, whether it's tablets, QR codes, they scan a code, a really easy review link comes up, they leave feedback, and it comes to us. And the beauty of what we have, it's real time. Now, why is that valuable? Well, if you're a care operator with multiple locations across the country, you can see what happens at your care home within a real-time basis. That's incredibly valuable. Now, this isn't anything new in different sectors. This is all happening, but no one's really using it in social care. So what I'm excited about most about the review industry within healthcare is that it's real early stage, and the evolution of reviews at the moment is going from stars on Google to collecting data about the service that they provide, and then from that data you get valuable insights that then enable you to benchmark yourselves not just locally but internationally. So there's a whole bigger picture around reviews. They're not just for stars on Google, although that's important, but it's also about increasing staff morale. It's also about flipping the narrative about the perception of social care. So we collect feedback from care homes, and the reviews we get are absolutely lovely. And when we post these on social media, the feedback from staff is beautiful.
So when those reviews come into the system that you have at Doctify, then those are internal reviews, and then you are free to publish those reviews as you see fit.
Yeah, so the review, I mean, without going into too much about what Doctify does, but this isn't, I don't want this to be a sales pitch. I just want to highlight that there are systems out there in the world that enable providers to collect high volumes consistently. There are systems out there that then enable you to push onto your online presence to make you look better online. They can then feed into your website to increase conversion. They can also feed into the governance side of things, so your CQC. There are things out there that can do all of that. We're one of them.
All right, I see. So what we're talking about here is for those operators who are wanting to increase the volume of reviews and testimonials, there are systems such as what Doctify is, as far as I understand, where it makes it easier for them to do so. They're presenting this QR code, as you mentioned, and then they send their review testimonial using this digital system, but then it's up to the operator to decide where they put those reviews.
So the reviews will come into the Doctify profile that then sits online. So when you Google that care home, there will be that third-party verification, which is very important. The reviews can also feed into your website.
I see.
Yeah, it's there for Google governance issues and also for your own internal insights. But
Nice.
look, it's like I said, we haven't reinvented the wheel at all. But at the moment, if I was, for example, in Cambridgeshire, if I was looking, I've got on average 20 reviews spread out over over 7 years to make a choice. 20 reviews spread out over 7 years, Adam. Now in Cambridgeshire, so and I just believe consumers deserve better. There are more reviews for a toaster, more reviews for your taxi driver. And that shouldn't be the case. Something so emotive and something so important of placing a family member into care, you want to be able to read yesterday's review on that care home. And currently within social care, you can't.
Yeah, I see. That's great.
So there's...
Understood. Yeah, perfect. Great. And there's a thought that's come to my mind, because I know we're talking about all these various platforms where these reviews can be left. And I think I mentioned carehome.co.uk, which has that paid for, which can boost your paid for rankings up at the top. But I think Automla, correct me if I'm wrong, Automla, or correct me if I'm wrong or right, carehome.co.uk, I think Automla is more organic. Automla is another care operating ranking system, but I think they are organic and they don't have that paid for elements. Just thoughts out there. But on the question of negative reviews, because of course that happens, and those negative reviews can appear from family members, staff on Facebook, carehome.co.uk, for example. We can talk about the press in a moment, and also Google. Someone can put a negative review on that. So just a thought on that, about how best to handle it. And I'll come in here because we've dealt with these ones. So if someone puts a negative review on Facebook, ultimately, if it's on your Facebook page, you do have ultimate power on what to do with that review. However, my general advice would be to treat, if it's a reasonable negative review, is just to handle it as best you think about how best to respond to it by the Facebook review page. Possibly move that conversation, if necessary, off Facebook. I think probably my very, very generic and general message would be human, respond to it, and respond to that negative review as you would if that person walked into your front door. So you would treat it reasonably and properly. But ultimately, as an owner of a Facebook page, you do have powers literally to ban people and delete them and remove comments.
Yeah, so look, I mean, I don't agree with kind of, removing that stuff or ban, for us, it's important that you respond to the reviews, like you said, in a really nice way. But first and foremost, embrace the negative feedback. That feedback has so much content in it that it really could help improve the service that you provide. And if we think about it on a consumer level, whenever I search for a hotel, I always go to the negative feedback. Now, I will take a view on how the hotel manager has responded to that feedback. And if I take a view on it and I'm okay with it, then I'll go ahead and book. But it's all about learning. I work with a care home in Northern Ireland. They've got a bad review about a meal years ago, and they're still paying the price for it because random people were leaving reviews on Google. And the problem is with Google, it's there, but it's not, because there's no consistent reviews coming in, it stays there on top. Now, they've improved since then. they've got reviews with us talking about completely the opposite. So yes, you're going to get negative feedback. It's important to respond to it. It's important to learn from it, and it's important to embrace it. But if you continue to collect feedback, you're just collecting other people's experiences straight after that may agree with it or may not agree with it. It's just collecting their experiences.
Yeah,
So
yeah.
it,
Interesting point. Interesting point. I think also on kind of examples that we've come across where I was thinking particularly around Facebook, and the same can apply for Google, is that people are ultimately being malicious, egregious, and incorrect. And that does happen where people are literally saying things that aren't true and malicious.
yeah,
So
I mean,
just for those who are listening, it's important to remember for Google, you do have a power to put this up to Google and ask them to address it, and they will have their own systems for doing that. Now, so for those listening, you do have the power to do that. In the same way, you do have the power to do that for negative reviews on carehomes.co.uk. And again, it's ones that we've been dealing with, is that yes, you have a power to respond, which is great, but also ultimately, as far as I understand for carehomes.co.uk, again, correct me if I'm wrong, anyone listening, is that you do have a power, if it is malicious and factually wrong, what they're saying, is to have that review removed.
Yes, I'm not too aware of their process. I know, obviously, we work with hundreds of clinics and hospitals in 5 different markets.
Yeah.
And we have independent medical people that assess all of the reviews. And
Yeah.
if it meets the terms and conditions, it will go live.
Yeah. Yeah.
That's very important for us. Like, our mission is to make sure that no patient, no family member, no resident goes unheard. But we really want to promote constructive feedback.
Yeah, just another thought I'll come in here, Paul, is that on the subject of where you can get positive testimonials, I know we were talking about this just before we started the episode, is that ultimately as well, what you can do is use positive testimonials from family members in your press releases and news releases. And also, if you manage to get BBC and ITV regional TV in, you can get that positive review in the press.
Yeah.
Now that means that you use when you're marketing your co-operator, is you can show prospective family members how other families have been talking about you positively in the press. So again, it's an additional way to we were talking about from the very top about where people can see your reviews. It's just another outlet you can.
And on that, Adam, as well, as like I said earlier, is every step of the consumer journey, if you can feed reviews into that step, then all you're doing is promoting the trust and the reputation of your brand. And that goes from Google, your website, third-party websites, PR releases, TV ads. Like, you only have to look on TV now, you see review boxes on there. So where there's a touch point where a consumer's looking at your page, it's very simple just to build trust with them.
That's great. That's great. Wonderful. Good, Paul. Well, listen, that's been a great episode. And before we go, have you got anything else to say that you feel we've not covered today?
Yeah, I kind of mentioned this earlier, but I'd love to kind of just remind everybody that the review industry has evolved massively over the last 5 years. It's gone from collecting reviews on Google to now becoming a really valuable data insights tool. So you can use the reviews that you collect to improve the service of care that you provide. You can then use that for benchmarking and insights. And review collection is just incredibly valuable, not only for you as a business, but also from consumers. So thank you so much, Adam, for giving me an opportunity to talk about it. And thank you very much.
Thank you very much, Paul. Thank you.